We're going to talk about increasing the effectiveness of your hearing test appointments. I'm Jeff Szmanda. I advocate for person-centered care. Person-centered care by way of education can lead to a feeling of partnership with the hearing care professional, and a feeling of partnership leads to a more effective hearing test appointment. I'll be focusing on educating prospective patients or clients before the appointment and then leveraging that education during the appointment. So let's get started with why. Why is educating hearing impaired persons for their first hearing test so important? Well, there are three challenges in the marketplace. First, OTCs are compelling clinics to differentiate both their products and services. Clinics need to demonstrate their value proposition. Stigmas associated with hearing aids persist as barriers hindering hearing aid adoption. Let's look at these stigmas. We know what they are. And prospective patients are often afraid of being sold. Consumers are afraid of the unknown and afraid of making a mistake. The unknown and making a mistake. The unknown and making a mistake. This fear and apprehension needs to be not just alleviated, but transformed into a positive perspective and a feeling of partnership with the hearing professional. How? Prospective patients and their families need to know, what about over-the-counter hearing aids? They need to realize that hearing healthcare is the smart move, and they need to feel that you are on their side of the table. This can be achieved with a simple reference to excellent hearing test preparatory information. Well presented, appropriate, easy to understand, and unbiased information. Information that creates interest in their own hearing and in their own hearing test, and fosters a more engaging, richer hearing test experience, and greater appreciation for quality hearing health care. We want to foster a positive attitude toward hearing health care and replace stigmas with hearing health care is a smart move. In fact, let's stop mentioning the word stigma. Instead, let's start saying, hearing aids make me look smart. Again, we want to direct potential patients and clients to well-presented, appropriate, easy to understand, and unbiased information that creates interest in their own hearing and their own hearing test. Let's cover specific and appropriate topics, techniques, and strategies for implementation. We want to identify topics that address both barriers to and benefits of hearing health care. Addressing barriers and benefits. Here's an example in this Guide 1, What is your attitude toward hearing aids? The topics in Guide 1 are informative and interesting and help shape a positive perspective. The prospective patient and family think, yes, I get it. Let's look at A1, Understanding Speech. Note the level of simplicity and yet comprehensiveness in which this educational material is presented. If you've ever seen Dr. Ted Venema present, you know how interesting and engaging his presentations are. Note that the video is only 7 minutes and 20 seconds long. Brief, succinct, and impactful. Now let's look at 1C, Reducing Stress and Frustration in Your Relationships. Among the featured articles and videos, let's select IDA Institute's Patient Insight Films. Here, IDA Institute organized brief videos to which the prospective patient can relate. This demonstrates empathy, which fosters rapport with the hearing care professional who referred this information to them. Now let's look at Guide 2. It helps to understand. Great, relatable, and engaging information in Guide 2. Why they should bring in a familiar voice. Understanding speech and noise. Comments on OTCs from professionals. So when they come in for their hearing test, many objections will already be overcome. Guide 3. Empowering the prospective patients and further enabling them to engage with the professional. Guide 4. Building credibility. Must be a confident provider who is empowering me with this information. Ah, yes. And Guides 5 and 6. Now you know the family will use this to get through to the prospective patient. You know they will. And how important is that? Let's cover techniques for engaging prospective patients and families in a discussion of the topics in which they are interested. Now you can engage, relate, and build rapport. Guide 2. Same thing. Engage, relate, and build rapport. You are building an environment in which the engaged prospective patient feels respected and senses a partnership with the professional. And you are more engaged with the prospective patient. There's a mutual trust. They're on the same side of the table. And it's mutually fulfilling. Ah, yes. And now I'm going to show you how easy this is. Just refer them to HearingTestPrep.com. The 6 guides are on HearingTestPrep. There are 2 easy ways to refer this information to them. First, when you schedule a hearing test appointment, add something like this. Do you know about HearingTestPrep? There's some valuable information on HearingTestPrep.com that will help us give you individualized care and make it easier for us to focus on your needs and goals. We'll be interested to hear your thoughts on it. Now, there's no cost for this. And the second strategy is simply to license the member clinic logo and include it in your newspaper ads and direct mail pieces. They will see it, and it'll drive them to your clinic. Please reach out to me for information on our pilot program. The pilot program grants free licensing of the member clinic logo in perpetuity to the initial limited number of clinics. The result is a more positive perspective on hearing aids and hearing healthcare, and a feeling of partnership with the hearing care professional who will enjoy more effective hearing evaluations and success rates, with an increased third-party attendance, word-of-mouth referrals, and testimonials. It's easy. It's more than easy. Well, I hope you enjoyed this, and will reach out to me at jeff@eachear.com. Thank you very much.